thought about what happens to a dental tool after it's been in your mouth? I mean, really thought about it? Well, it's not just a quick wash. It goes on this incredible journey through an unseen fortress of safety, all to get from your mouth back to a state of perfect, absolute sterility. So let's follow one of those tools, shall we?
Okay, let's really dive into this. You finish with your checkup, you do the rinse and spit, and you walk out the door. But for that little metal scaler or the mirror they used, their day is just getting started. And it's a journey, a meticulously planned route that is designed for one thing and one thing only: keeping you safe. You know, it helps to think of it like this. Every single dental office is a constant microscopic battlefield. The enemy? Totally invisible microbes. We're talking bacteria, viruses, fungi, the whole lot. And in this battle, the dental team are the generals, armed with a very precise strategy to win, every single time for every single patient. So, let's step onto this invisible battlefield for a moment. Understanding this fight is absolutely key to appreciating why every single step that comes next is so incredibly important. It's not just about the patient's safety, but the safety of the entire dental team too.
All right, so the very first move in this whole defensive strategy, it isn't even cleaning, it's sorting. Just like in a real battle, you have to assess the threat level first, right? Not all instruments face the same kind of microbial combat, so they get triaged based on the risk they pose.
And this is how they break down that risk. It's pretty fascinating. You've got three main categories. First, critical instruments. These are the ones that touch bone or soft tissue, and they must be sterilized. No exceptions. Then you have semi-critical tools, like a dental mirror that touch mucous membranes. They also need to be sterilized, or at the very least, get a high-level disinfection. And finally, non-critical things, like a blood pressure cuff that only touches your skin. Those can be thoroughly disinfected. This sorting step right here is the foundation for everything else.
So, once an instrument is sorted into its risk category, it heads down one of two main paths: sterilization or disinfection. Now, these words might sound kind of similar, but in the world of microbiology, the difference between them is like night and day. This is the absolute core of the whole decontamination process.
And here it is, the key difference. Disinfection is great. It gets rid of most of the nasty disease-causing microorganisms. But sterilization, that's the ultimate clean. It eliminates all microbial life. I'm talking everything, even the incredibly tough bacterial spores that can survive almost anything. Sterilization is a complete and total reset to zero.
Oh, not even close. Just because a tool is headed for disinfection doesn't mean it's a one-size-fits-all kind of deal. The level of disinfection has to perfectly match the level of risk that we were just talking about.
This shows that hierarchy perfectly. At the very top, you've got high-level disinfection. This uses super powerful agents like glutaraldehyde to kill everything except for those super stubborn spores. Take a step down to intermediate level, which uses things like chlorine compounds to kill most pathogens. And then at the base, you have low-level disinfection, which is all about reducing the overall number of microbes on non-critical surfaces. So to win this microscopic war, the dental team needs a pretty powerful arsenal. Let's take a closer look at the specific weapons, both physical and chemical, that they use to get this profound level of clean. First up are the natural forces. Heat is a huge one, used in machines called autoclaves that are basically like high-pressure ovens. But they also use other cool things like UV light for disinfecting surfaces and even ultrasonic vibrations to literally shake microbes and debris right off the instruments. It's like using physics to fight germs. Then we get into the chemical agents. The first line of attack usually comes from detergents, things like soaps, or chlorhexidine. Their main job is to attack and break down the outer cell membrane of a microbe. It's kind of like breaking down the castle wall before you storm the gates. For a much more powerful assault, you've got the alkylating agents. This includes some heavy hitters like glutaraldehyde and ethylene oxide. These chemicals don't just mess around on the outside, they actually get inside the microbe and completely disrupt its essential proteins and nucleic acids. They neutralize the threat from the inside out. And finally, there are the oxidizing agents. Think things like chlorine, iodine, and hydrogen peroxide. These guys work by literally oxidizing or chemically destroying the microbial cells. It's a really effective final punch in the chemical arsenal.
Okay, so the instruments are now sterile, but the battle isn't quite over. That fortress of safety has to extend beyond just the tools. It has to protect the people, both the staff and, of course, the next patient. And for that, they need armor.
And this is armor we've all become pretty familiar with recently. personal protective equipment, or PPE. We're talking about well-fitting gloves, masks, serious eye protection like goggles or face shields, and protective gowns. Every single piece is a barrier, another layer of defense that protects everyone in the room from any potential cross-infection.
But wait, what about the room itself? You know, the chair you're sitting in, the big light they use to see? The protection has to cover the entire environment.
And this is where environmental barriers come in. You've probably seen them and maybe not even noticed. Those thin plastic films covering the headrest, the lamp handles, the buttons on the equipment, these simple little barriers are incredibly effective. After each patient, they're just peeled off and replaced, which prevents any contamination from ever touching the surface underneath. Pretty smart, right?
When you put it all together, it makes one thing crystal clear. Every single step we've just walked through, the sorting, the sterilizing, all the chemicals, the barriers, it's all part of one single robust system. And that system is designed for one goal: to prevent the transmission of disease and to ensure absolute safety.
And that really brings us to the final thought here. The next time you sit down in that dental chair and you see that tray of perfectly arranged, gleaming metal instruments, you'll know exactly what it represents. It's not just a collection of tools. It's the end of a long, incredibly meticulous journey. It's a symbol of that unseen fortress, built from the ground up, all to protect you.